Hi, my name is Amelia. I use she, her pronouns. I am an intern with the More Treatment campaign. I wanted to talk to you today about the Drug Addiction Treatment and Recovery Act, or IP44 as it's also known. It is a citizen initiative that Oregonians will vote on in November. The idea is pretty straightforward. Instead of arresting and jailing people for drugs, we would begin using some existing cannabis tax money to pay for expanded addiction and recovery services, including harm reduction and housing support, to help people get their lives back on track. So this ballot measure is twofold. It removes criminal penalties for small amounts of personal possession of drugs, decreasing incarceration rates, and uses existing cannabis tax revenue to fund these services, increasing funding for treatment. Next, you'll be watching a video on the ballot measure that features Janie Gullickson, a chief petitioner on the campaign, and someone who has experienced addiction firsthand.
My name is Janie Gullickson. I'm the Executive Director of the Mental Health and Addiction Association of Oregon, and I'm a person in long-term recovery. I was addicted to drugs for over 22 years without real access to treatment. I think the worst of the worst was when I was homeless and wandering the streets, talking to myself, trying to stop traffic. Addiction cost me my kids, my education, and my freedom. I started getting in that cycle of incarceration, and in jail, there wasn't access to treatment. There wasn't any social worker or case manager that came in and asked, what is the underlying issue? How can we help you? No, I just repeated that cycle over and over and over. Who's got something that's on their mind? Treatment was the turning point, that key piece that taught me a new way to live. Today, I have a relationship with my children that had been completely severed. I was there for my parents as a daughter they could feel safe with as they went through the end of their life. Instead of access to treatment, what we have today is actually criminalization of addiction that ruins lives. This ballot measure funds treatment and recovery support services. It decriminalizes addiction. The stakes are life and death. Expanding treatment will save lives. I could talk all day about the gifts that recovery has given me. Going through the checkout line and paying for the things that I have in my basket, turning the doorknob to walk into my house, hosting holidays with my kids and grandkids never gets old. I think people should support this initiative because treatment, not punishment, is the right approach.
So I think Janie explained very well what the problem is, but I'm going to go into some numbers and details. 1 in 11 Oregonians struggle with addiction and problematic substance use. And Oregon ranks 47th in the country for access to treatment right now. Yet billions of dollars are spent annually. So how is Oregon still at the bottom? I would say this suggests that while there is plenty of money set aside to address addiction apparently, that money isn't being utilized in the most productive way. This graphic shows the stark disparity between funds allocated to the prevention/treatment of problematic substance use and addiction, and funds allocated to address the consequences of problematic substance use and addiction. Addiction is a public health issue. When time and money is reduced away from prevention and treatment, and what it is that the resources that people who suffer from addiction and problematic substance use actually need, it's taking those resources away from the best possible solutions and actually adding to the problem. It also seems there's a direct correlation between how little is spent on prevention and treatment and how prevalent drug and alcohol related deaths are. So you'll have to ask yourself, where is all this money going then? I think if you think of the amount of time, staff, money required to arrest someone, house them in jail, and convict them, that's likely where the majority of the money is going right now. Although this approach is not investing in recovery or recidivism actually, nor is it investing in the safety and betterment of communities. Problematic substance use and addiction are so prevalent in our jails and prisons. 7 out of 10 people that are currently incarcerated report substance abuse issues. These facilities are not helping. Treatment programs in jails are generally only Alcoholic Anonymous meetings and Narcotic Anonymous meetings. And treatment programs in prison are very limited. I'm talking like 25 beds for thousands of people that are currently incarcerated in state prisons. Additionally, spending time in these institutions creates more trauma, which can lead to further problematic substance use and addiction issues. We also know that Black people and people of color are more likely to be stopped, searched, arrested, convicted, harshly sentenced, and saddled with a lifelong criminal record. This is particularly the case for drug law violations, despite drug use across races being equal. This only adds to the oppression and marginalization of Black communities and communities of color. Unfortunately, in this country, the consequences of a criminal record don't stop once you've served your sentence. This record will impact the most basic needs of one's life, such as employment. Even with the ban the box law here in Oregon, employers can and will still run background checks on their employees. And there is no law saying that they can't fire an employee once they learn of their criminal record, which is often the case. Housing. As you can see from this graphic, those who are incarcerated are more likely than the general public to become houseless. Having a criminal record can get your rental application denied, no matter if it's a misdemeanor or a felony. It's really up to the property manager, and in Portland, property managers can be very picky because there are so many people to be housed. That's not just the case for Portland either. There are other counties and cities in Oregon. The federal government will not offer all students with a criminal record the option to receive grants and loans for their education. If you have been convicted of any drug offense, a misdemeanor or a felony, you are not eligible to receive financial aid. These are only a few of the many barriers that exist for formerly incarcerated people and their families. Finally, I want to share with you a video from another one of the campaign's chief petitioners, Haven Wheelock, on why this ballot measure is so relevant and necessary during the time of COVID.
Hey friends, it's Haven, just checking in. I'm a chief petitioner for IP44. I am also an essential healthcare service provider right now, providing healthcare services to people who are using drugs. And we are open and serving folks to the best of our ability in spite of things being shut down across the community. I have to say it's really scary. And it's really hard to be coming to work every day right now. The folks we are working with, they're really struggling. They're really scared, both of the virus and of how hard it is to survive when their means of making money has disappeared. And they're scared of not of being arrested for both the drugs that they use and the fact that they don't know if they will get arrested if they're houseless at this point. They're scared of catching the virus in jail. It's been heartbreaking, and I'm exhausted. Because all of the things we were already battling before this are still there. We're still taking overdose reversal reports. We're still testing folks. We're still trying to refer people into services that are hard to get into right now. And at the same time, I am so grateful that this campaign is happening right now, because I am watching and partnering with many supporters of IP44 to come up with innovative ways to keep care coming to those that need it. And at the end of this, we are going to create some amazing networks and some amazing innovative tools to help improve our substance use spectrum of care. And if and when IP44 passes, we'll actually have the ability to maintain all of these amazing programs and partnerships that we are building right now. We're building them now in crisis, but we can sustain them in the future by voting yes on IP44.
So what can you do? Vote in November. If you aren't registered to vote in Oregon, please do so. Also, if you need to update your voter registration, do that as well, so your ballot gets to the right place. If you can, donate $1 or $5 or $50, whatever you can. And you could share this link too to your network if you would like, and ask them to volunteer as well. Sign up to volunteer. You can do this via the website or email me directly. I have provided a link to a survey that would help me get to know your interests better, as well as give me your contact info if you're interested in volunteering. So if you're watching this, you probably won't be able to click on the link. However, I have put the full address there. You can just put it into your browser and it should work. And finally, probably the only other thing that's easier than making sure you're registered to vote and that you do vote is just talk to people. Share this information with communities that are directly impacted, as well as your social networks. If they're interested in getting involved with the campaign, direct them to our website or me. Thank you so much for your time and attention. If you have further questions, don't hesitate to reach out.